Okay.
As a little girl and growing up around my family and watching the people I love and respect choose all the different career paths, I've always wanted to be a farm girl and have the white picket fence house and to be a farm wife. I now realize that the farm wife is probably going to need to work in a town to be able to have health benefits for the husband that is working on a farm and our children. I think the medical career would be a great career for a wife and a mother because I can work long shifts for 3 to 4 days and then have some time off for my family. As I grew up, volleyball and basketball were my life, so of course I wanted to be a professional volleyball player and live my life playing volleyball. As I have grown up, I have been more open to my options and I have changed my career goals into the medical field, and I feel that is where I will be happy and succeed. Possibly I can play volleyball during college or at least an intramural team. Before I go into the medical field, I wanted to interview someone in the medical field that I am interested in. I was lucky enough to interview Nelda Vogt, one of the many radiologist technologists in Fairmont, Minnesota, on October 9th, 2012. We interviewed in her work area at the Center for Specialty Care. She put me in as a patient, and I know her from getting my own x-rays or just from my sister working there as a nurse manager. I had selected her out of the many because of just knowing her well. I think that it improved my comfort level when asking her questions I had for her. Preparing myself for the interview helped me because I knew what I wanted to talk about and what the questions I wanted to ask her to gain the knowledge in the career I am considering. As a radiologist technologist, she is in charge of listening to doctors' instructions and taking pictures of the bones or ligaments that need to be photographed to be looked at closer. She has always worked in the medical field and taken other people to their doctor's appointments and watched them get x-rays, which boosted her interest in wanting to learn more about it, and later went into the appropriate school to gain her degree and achieve career goals. She has now been in radiology for 8 years after attending Iowa State and getting her certificate from Iowa State. She didn't think the schooling was hard, but she did join in study groups and anything she could do to achieve the best she could possibly be. She has her ups and downs, but she learned to be more adaptable and gain patients' respect. Her communication skills level isn't very high and she didn't take any extra classes to help her. She was faced with more face-to-face communication with patients than was expected, and also to have communicate with the patients when showing people how they need to position themselves to get the best picture possible to identify what is wrong with doing their tests. As she finished up talking, I asked her what she would have done differently at her job today and what classes or things would have made her better at her job. Her answer was that there are still career options that she could have still chose to further her career and if she decides to do that, but at this point she is not planning on further education. She stressed that there were things that she could have done when she was younger to make her career path easier, including her high school diploma, but also nursing assistant classes, speech classes, and just your basic science classes. She stressed in her interview to look into extra nursing classes and work in a nursing environment before you head to college. It will help you greatly to have hands-on experience with patients and training basic things, like taking blood pressure, taking notes for doctors, learning how to cope with the patients in different areas for needs of your patients. Patients need help in certain circumstances, including how to lift a patient properly, pain tolerance for patients, claiming patients when they become nervous, or etc. She also said that the work experience that you have in your high school and college will help you choose the right career path. She also wanted me to be careful choosing a career as it is hard to find a job in this economy. Nelda was a great person to interview about this topic. I've actually decided to choose a different career path other than radiology. As I was doing research after this interview, I realized that the science classes required and the degree turning into a 4-year major was something I was not interested in pursuing. I've been considering surgical tech as a new degree, and I will be taking her advice and have signed up for a nursing assistance class that will start in April to get more in-depth college preparation and help me in job seeking when I get to college. I will also focus on face-to-face